as you know, I hope my name is Dr. Charmaine Gittleson. I'm the non-executive chair of the board of Percheron Therapeutics Limited, the company about which we're meeting today. So I'd like to take this opportunity to welcome all shareholders, both in person and those online virtually through this portal, and guests to this general meeting of Percheron Therapeutics. The meeting is being conducted in person at the offices of Minter Ellison in Brisbane and virtually through the Lumi online portal. But let me first apologize that I'm unable to attend in person today in Brisbane. Excuse me, I'm otherwise previously committed and unable to be present in Brisbane, which certainly does not undermine my commitment to Percheron. And because I'm not there in person, I'm going to shortly ask our Managing Director, Dr. James Garner, to conduct the formal business of the meeting on my behalf and as my on today's meeting. Challenging time for Percheron shareholders, for the board and the management. Both the board and the requisitioners of today's meeting have made their points over several weeks. And this meeting today is really to deal with the formal aspects of what is in front of us, and it is about the future of the company. The question in front of shareholders today is what kind of business you want Percheron to be and who you want to lead this business into the future. Regardless of the outcome of today's meeting, Percheron will undoubtedly emerge from this period as a different company. In particular, the company will need a substantially new pipeline or business plan with which to engage investors and shareholders. We will also, for the time being, become a rather smaller company. A number of valued colleagues have recently left the organization. We've made changes to executive and board compensation by reducing and deferring fees, and the company cost base has been dramatically reduced. The business organization, but status and restored. With that, I'm now going to hand over to Dr. James Garner to drive the formal business of the meeting. Thank you. James?
Thank you, Charmaine. Ladies and gentlemen, good morning. I'm James Garner. I'm the Managing Director of Percheron Therapeutics Limited. This general meeting has been called by members of the company, including David Kenley, entities associated with Gennady Kuchin, Robert Moses, Gregory Peters, Dale Reed, and their respective related entities pursuant to Section 203D and Section 249D of the Corporations Act. I note that a quorum of shareholders is present as required by the company's constitution, so I declare this general meeting of Percheron shareholders open. I intend to vote all undirected proxies, appointing me as a proxy in my role as chair of the meeting against all resolutions. Now, all shareholders will be given the opportunity to vote and to ask questions at the meeting today. I'm going to ask that we address questions that are specific to particular resolutions with that resolution as we proceed through the formal business of the meeting. Questions which are more general in nature or which have applicability to a number of resolutions we'll address at the end of the meeting before voting closes. For those shareholders participating through the online portal, I encourage you to download the online portal guide if you have not done so already from the company's website. I will now go through the voting instructions. First, voting in the room. Before I address voting instructions for those shareholders attending in person, I want to stress that any shareholder attending online must lodge their votes through the Lumi platform, even if they have already voted prior to the meeting. This is a critical point because when you log on to the platform, any prior votes will be cancelled, and so you will need to vote again in the meeting. Now, for those shareholders in the room, you will have received a voting card at the registration desk. Persons entitled to vote at this meeting are all shareholders, corporate representatives, attorneys of members, and proxy holders who hold a green or a blue voting card. Detailed on the reverse of your voting card are the resolutions being put to shareholders at this meeting. Please ensure that you print your name where indicated and sign the voting card. Please note that any unsigned voting cards will be invalid. If you require any assistance, please raise your hand and we'll arrange for a representative of Boardroom to assist you. When you've finished filling your voting card, Boardroom will collect them at the end of the discussion of all resolutions when I announce that the poll is closed, and all votes will be collected online and in person. Turn now to online voting and to questions. For those shareholders online, you can submit questions at any time. To ask your question, select the messaging tab at the top of the Lumi platform. At the top of that tab, there is a section for you to type your question. Once you've finished typing, please hit the arrow symbol to send. Here in the room, please be advised again that only shareholders holding either a green or blue voting card or a white non-voting card are entitled to ask questions within the room. Please also note that while you can submit questions online from now on, I will not address them until the relevant time in the meeting. As I said a moment ago, we'll address questions that are specific to particular resolutions at the time of considering that resolution. Questions that are more general in scope, we will address towards the end of the meeting. Your questions may be moderated, reworded, or if we've received multiple questions on one topic, amalgamated together. And finally, due to time constraints, we may run out of time to answer all questions. And if this happens, we'll endeavour to answer them in due course through another channel. Now, if you are eligible to vote at this meeting, on the Lumi platform, a new voting tab will shortly appear. Selecting this tab will bring up a list of resolutions and present you with voting options. To cast your vote, simply select one of the options. There is no need to hit submit or enter. The vote is automatically recorded. Let me stress again, online attendees who have already submitted a proxy prior to today's meeting and who have now logged in as a shareholder will need to submit their vote online. You will have the ability to change your vote up until the time I declare voting closed. Voting today will be conducted by means of a poll on all items of business. I now declare voting open on all items of business in the room and online via the Lumi portal. The voting tab will momentarily appear on Lumi. Please submit your votes at any time. I will give you a warning before I move to close voting. We move now to the formal business of the meeting. I propose to take the notice of meeting of this general meeting of Percheron Therapeutics Limited, dated 24th January 2025, as read, and I will now proceed with the items of business. I should say that limited copies of the notice of meeting are available if anybody requires a copy. So we turn now to the resolutions. There are 5 resolutions in total to consider, and we will discuss and vote on each resolution in turn. As already noted, it has been determined that each resolution will be determined by a poll. I appoint Mr. Rashad Bashara of Boardroom Pty Limited as the returning officer to conduct this poll and report the results of the poll to me. I note that all resolutions in the notice of meeting are to be considered as an ordinary resolution and must be approved by a simple majority of the votes cast by shareholders entitled to vote and voting on the resolution. So we turn now to resolution number 1. The removal of Dr. Charmaine Gittelson as a director. The resolution is to consider, and if thought fit, to pass the following resolution as an ordinary resolution, that in accordance with section 203D of the Corporations Act 2001 Commonwealth, Dr. Charmaine Gittelson be removed as a director of the company with effect from the end of the general meeting of the company at which this resolution is passed. Proxies received as at 9 a.m. on Sunday, 2nd of March 2025 are as shown on the screen. Are there any questions in relation to this resolution?
I wanted to ask a couple of things, and if can the chair hear me? I wonder if she can hear me.
I believe she can, yes. It's an open mic in the conference.
So over the journey, you know, I've listened to hours of webinars and read hundreds of pages worth of announcements, and which are mostly pretty repetitive a lot of the time. But and I've placed a lot of trust in the information that I've received, and of course, because of the nature of medical things, that I've showed unlimited patience because these things move at a snail's pace. So with all the trust I placed in it and all the hope, and to have it all dashed was pretty hard. And I for that to be consequence free, I'm finding that to be a lot to ask of me, right? And I'm worried about the message that would send to members of the board if I just reset and start again, because that is going to be a lot to ask for me. So what I wanted to ask is, I'm going to really want to see some quick results, something quick and positive. And I don't care about the share price necessarily, and I don't care about getting value for money. I don't care about all that. I only care about patience and me. All the hedge fund guys and all the money, the money's not coming out of their pocket anyway. So, but I would like to see some quick, positive results. And I'm wondering if the chair can reassure me in some way that something like that's possible.
So we'll take that question now, as it is directed at Charmaine and in her capacity as chair. We have had a question online recently regarding what is the board's strategy to get the company back on its feet. And I'm going to suggest we merge those two questions, because I think they're similar questions. They come from the same place and end up in the same position. Charmaine, are you able to address that question as to perhaps articulating the board's strategy and where you think we go from here?
Sure. So thank you for the question. That online question and the question in the room, I think, are probably the most important questions that should be addressed at this meeting. You know, we as a board and the management team were devastated by the results of that study. I had done my diligence, as had James and Gil, looking at the results of earlier studies with this compound, and we felt confident in, and this is really specifically addressing the individual in the room that asked this question. We felt that there was sufficient evidence to demonstrate that ATL 1102 had biological activity. In other words, it was able to hit the right targets in the body, and hopefully, you know, that it's always a certain leap of faith, but we felt that it made sense medically that hitting those biological targets would have an impact clinically. Unfortunately, ATL 1102, while hitting those biological targets, symptoms, the clinical symptoms, study was designed, and I, along with shareholders, were disappointed for multiple reasons. One, for the patients, for their families, and of course, for the company and the investment that had been made in ATL 1102. So I understand that remaining committed to biotech can be very difficult. Small biotech companies, particularly in Australia, with one asset, very difficult to know which one is going to be successful and which one isn't. And already in June, July last year, well, actually before that already, when we looked at board strategy, we came to the conclusion that as a company, a biotech company, we really needed to diversify our pipeline. And we started doing that in around June last year, looking at other assets while still remaining committed to ATL 1102. We felt that for two reasons, we needed to look at other assets. One was to mitigate risk in case the compound was not as, and secondly, because we really felt that for shareholders, they shouldn't be investing in a second asset immediately, looking and exploring that. You know, unfortunately, we weren't able to conclude that before we had the results of ATL 1102, and we intensified doing that assessment since then. But that assessment of what's been available, what's out there, what's in Australia, what's overseas, what could we as a company with our skills and our size and our location do that could add value to shareholders? We've been looking at that since more than half more than 8 months already. The December time, we've taken a few steps to stabilize the organization. And this now starts to bring in the second part of the online question. So one of the first things we did was, obviously, we stopped the study. And why? We've been asked this many times. Well, it's for an ethical reason. So ethically, no matter what you as the sponsor would like to do with an asset, ethically, as soon as a study does not have a positive outcome on a primary efficacy endpoint, you have to stop the study. You have to withdraw the patients in the study from that study, and you have to release them and allow them to be available to other treatments. And so we've been challenged for stopping the study as quickly as we did, but that's why we had to do it. And anybody that understands biotech development will understand that that is a critical point that we had to follow. No matter what subgroups you're involved with. But we stopped the study, and we then took immediate action to reduce spend on the study and within the company. And so, as I said in my introduction, we reduced expenses by letting certain staff go, and our CEO has voluntarily reduced or deferred 50% of his salary, and certain board fees have been deferred as well. We continued our exploration of ATL1102 just to make sure that there weren't any other indications that we could take ATL1102 into. And part of that was looking in depth at the other results from the study, and we have shown those in a webinar and shown definitively that the drug was active, but unfortunately the pathways that are involved in inflammation and in DMD and probably a number of these diseases go beyond the target that ATL1102 was focused on. We then have continued our exploration of other assets, and that is part of the reason why James attended JP Morgan. Not a big cost for him to do so, but that was because we were looking very closely at potential assets, and we wanted to make sure that what we were looking at and considering for the organization really was the best option for us, and we weren't missing something else. And so we attended JP Morgan. James has had certain conversations, and we've done a lot of diligence looking through those assets. We haven't rushed anything. We've really been looking very carefully, and we're very fortunate in that the three of us, plus some of our internal staff that have been with us for the December-January period, have a lot of experience in evaluating and selecting assets that have, in our past experiences as individuals, we've selected correctly and have taken through to registration and commercialization. So we've been able to pull on those internal resources, not spend money externally. The third thing that we've done is really look at business models and looked at the financials associated with business models. And there are two business models that we've been considering. The one is a merger or a reverse takeover opportunity, looking at both local and international assets. And the other thing that we've looked at is really changing the nature of this company completely and seeing whether the cash that we have in the company would be better off spent on investments in other companies where other people are investing in development. In the end, at this stage, what we've come down to is that we think that what we can offer our shareholders and the best opportunity to reverse that very sad outcome from ATL1102, so speaking to the first shareholder, is to consolidate our knowledge and our efforts, and then speaking to the online shareholder, is to consolidate our efforts around and our experience around a group of assets around a platform that address a rare unmet need. Now, and that was what we submitted a non-binding offer. And incidentally, from a legal point of view, we're absolutely entitled to submit non-binding offers. This is part of normal business. And to put ourselves in the run for being able to bring something into our organization, which is not just a single asset binary, but has a broader opportunity for us to develop. Now, unfortunately, we can't disclose what that is, the company, what the target is, what the platform is. We just can't do that because of the confidentiality of the non-binding offer and the company with whom we wish to be negotiating. But what I can say to both of those questions is that we've looked at what is the best financial model. We've looked at what can be controlled by this company. And let me assure you, this is not about James, about Gil, or about myself and our future careers or jobs or salaries. This is not about that. This is about Percheron and what Percheron can do. And we all know that over time with development companies, and we've seen it even in this company with Antisense and going into Percheron, that the board and the management team change. It's not about us. This is about Percheron and what a biotech company in Australia can do and can offer the biotech industry, shareholders and investors in Australia, and patients globally. And that's what we've put at the forefront of the strategy that we think is the best option moving forward. And over the next few weeks, as we are able to, we will share that with you. We have endeavored to be transparent with you ever since I took control of took chair of the board and James came on as managing director. We have been as transparent with you as we have been allowed to by ASX rules, and we'll continue to do so. And as we put forward the strategy and explore this more, the non-binding offer, we will share the information with you as we can. I trust that that long answer has answered both of those questions. Thank you.
Thank you, Charmaine. With that, I'm going to turn to Resolution 2, removal of Dr. James Garner as a director. As this resolution concerns myself, I will recuse myself as chair of the meeting, and I'm going to ask Deborah Ambrosini, Chief Financial Officer and Company Secretary of Percheron Therapeutics Limited, to present the resolution.
Thanks, James. We will now consider Resolution 2, which is the proposed removal of Dr. James Garner as a director of the company. To consider and, if thought fit, to pass the following resolution as an ordinary resolution. That in accordance with Section 203D of the Corporations Act, Dr. James Garner be removed as a director of the company with effect from the end of the general meeting of the company at which his resolution is passed. The proxies on screen are at 9 a.m. Sunday, the 2nd of March. Do we have any questions on this resolution?
Yeah, can you give me some indication of what you do in the company or will be doing in the company?
Thanks, Sarah. So I'm the Chief Executive Officer of the company. My responsibilities are severalfold. The first is that I oversee all the activities of the company. I need to oversee the drug development work going on in the company. I need to oversee the company's business operations, its finance, its investor relations, its compliance, its facilities, occupational health and safety. All those activities of the company are part of the responsibility of the Chief Executive Officer. At the moment, a substantial part of my time when I'm not focused on general meetings is concerned with identifying and negotiating a new in-licensing opportunity to the company. As Dr. Gittleson just said, we see the best path forward for the company and its shareholders consisting in bringing in one or more new assets into the company, developing those and building their value. That's a very, very substantial part of our work. Given the reductions in headcount, I'm also at present substantially responsible for the conduct of our clinical trials. Although our clinical trial was terminated in December, we still have a tail of regulatory and legal obligations to discharge. We still have some contractual work that needs to be discharged. That has been part of my responsibility. And then once we have a new asset on board, we're going to have the task of presenting the company's new story, its new identity, its new business to the investment community and trying to draw them back into the company. I think our number one priority as a board, my number one priority as CEO, is to rebuild the value of the company for its shareholders. Now, right now, we have nothing to talk to investors about. But if we're successful in completing the negotiations that Dr. Gittleson referred to, then I think this company will have actually a very, very compelling and persuasive story to put in front of investors. But the investors won't come themselves. We'll have to get out there and sell it. There's no substitute for shoe leather when you've got a new story to put in front of people. And that in turn will be a big part of my role as well. So hopefully that gives you a sense of some of what I've been working on, some of what I would like to continue working on, depending on the outcome of this meeting.
So do you have a medical background, entrepreneurial background, or what sort of a background?
I'm a qualified medical doctor. I practiced medicine for several years. I did an MBA and worked for a few years with Bain & Company, a strategy consulting firm. I've spent approximately 25 years in the pharmaceutical industry, mostly in so-called big pharma companies, in both here and overseas. The latter part of my career in the pharmaceutical industry, I was a senior executive based in Singapore with 2 top 10 pharmaceutical companies. I returned home to Australia about 9 years ago, and I've been a public company CEO, a public company director of the life sciences companies for the entirety of that time. So I've built biotech businesses, and I've overseen drug development in the context of a multinational.
And what percentage of the company do you own at this stage?
I'm approximately 4% of the company.
Out of, what's that, how many shares in the company?
There are approximately 1.06 billion shares on issue in the company. I own 42.5 million shares. And I'd add that all of those have been bought out of pocket. None of those have been awarded as part of my compensation. They've been bought either in the open market or through share purchase plans.
Okay, thank you.
There's a question on that, please.
Got one behind you, Gennady, and then we'll come to you.
That's right. Just a question. So, I'm just curious as to why, I mean, you didn't pick up those shares when the company had the ATL 102 asset. And then in December, you purchased a bit more shares, but it was only a very small amount of shares. So I'm just curious as to why now you believe that you want to step in and commit a considerable amount of money. And, you know, I think that's good that the CEO has a stake in the company, but just very curious as to why that's happened in the last couple of days before the vote happened. So
I suspect this is going to overlap with Gennady's question. So Gennady, maybe you could ask yours and perhaps I can answer them together.
mine's more of a technical.
Excuse me a moment, I'm just going to get a drink of water.
Mine's more of a technical question in regards to disclosure and what's publicly available.
Sure. Well, let me answer David's question first. So the question was around why I've bought shares now. And I think a couple of things. First, quite candidly, I thought they were a good buy. I've been investing in life sciences for the better part of 30 years. I think this is a very capable, very well-connected team. That's a company trading at cash backing. I'm not in any position to offer anybody investment advice, and so please don't take this as such, but I think the company is quite a compelling investment at the moment. But more importantly, and to the point raised earlier in the meeting, I recognize that this has been a very, very difficult period for all the company shareholders. I recognize, moreover, as Dr. Gittleson just noted, that we're asking shareholders to trust us, to have confidence in this board and this management team, to get the company back on its feet, to restore it to health, and to rebuild the value of their investments. And I recognize that's a lot to ask. And particularly for the many shareholders who are not specialists in life sciences, who not even necessarily professional investors, it's a great deal to ask of our shareholders. And so I bought shares in the company recently. I invested about $500,000 of my money in buying shares to show that I'm not asking shareholders for any kind of confidence that I am not prepared to demonstrate myself. I think there are times as a board and as a public company director where you need to walk the talk. And what I wanted to say to shareholders through this purchase is that I believe in the company's future. I'm confident in the ability of this board to restore the value of this company. I'm prepared to put a substantial proportion of my personal wealth at stake to back that proposition. And so I am now the second single largest holding in the company's shares. And And I hope shareholders will see that as a vote of confidence in the company's future, because I am confident. David, one more.
I'll just finish up. So, and that's wonderful to hear. But the thing is, I believe that you guys are obviously said to the market you're rapidly progressing discussions, and you've obviously even made a non-binding bid for an asset. Don't you think that's not fair, that you're entitled to understand what those assets are and information, but yet shareholders actually, we don't actually have that insight that you do? And like, I just want to understand your thoughts around that and the recent purchase as well.
So we've been very clear, we've been very careful to disclose as much as we possibly can about the asset that we look to bring in. We have said that it is a rare neurological disease, and we have said that it is clinic ready, i.e. it is not yet in clinical trials, but it is at a stage of development where it could very soon enter clinical trials. Realistically, those are the only two things that materially determine the value of that asset. Exactly which neurological disease is not a material determinant of its value or its influence on a company's prospects. The precise modality by which it works, the company that originates, these things are matters of interest. They're, points of nuance that in the fullness of time we would like to disclose to shareholders. But they're not things that have a material impact on the value of this opportunity. So, and this was discussed very carefully at the board. We recognise that these are sensitive times, and the board was unanimously of the view that I was not then, and I am not in fact now in possession of any material non-public information that would restrict my ability to trade shares of the company.
It's just, you have that insight, but other shareholders don't have that insight. And but you're basically making an enormous pivot in this business, looking to make an acquisition, which we all have heard and acknowledge. But just very curious, to understand how you don't see that you don't have more information about all the assets that you're looking at and making non-binding acquisition offers for, and compared with other shareholders.
I think I've answered the question. I'll just reiterate my answer one more time. All the material things that would drive a valuation of this opportunity, would drive an understanding of the value of this opportunity at this stage, have been disclosed to the market in our 2 announcements in February. That's the view of the board. Good night.
So, more of a timing and governance question and relating to public disclosures. It appears you purchased shares within the closed period, according to security trading policy of Percheron, which prohibits you from purchasing shares until the next day after the half-year results are released. So given the timing of that, they would normally require approval from the board, which would need to be notified to ASX and Appendix 3Y. We have not seen that, and also given proximity to the vote counting and you having insight as to what the votes will look like in the lead up to closing of online votes. Just a question whether those votes that you associated with the purchase are included in the numbers here, and whether it's appropriate for governance reasons for them to be included.
Sure. So just to provide some context for everyone in the room, prior to this meeting, Gennady has made several allegations and accusations and statements about my purchase of shares, specifically about the small proportion of my total purchase that was performed on Wednesday, the 19th of February, which was the day that our half-year report went out. Like any public company in these circumstances, all we can really do in these situations is to put those allegations in front of our lawyers. We've done so. They're deliberating carefully. They haven't given us their advice. I would say that we have not received, or rather, if we were to receive any direction or request from any competent authority or any statutory body for any action in relation to those shares, of course, the company and I would immediately comply to the letter. We have not received any request or direction. And so at this stage, we have really nothing more to say about this until our lawyers have completed the review. I think that's all we can really say.
So can I ask, do you agree with the fact that you purchased shares during the closed period according to securities policy of Percheron?
I do not agree. This is under evaluation by our legal counsel. There's nothing more I really have to say about it until they've done that work. So,
Yeah, just in relation to the purchases, what is cash backing per share at this point of time?
as at our last financial statements, which are as of 31st December 2024, the net tangible asset backing of the company is 1.42 cents per share. 1.42 cents per share.
So at this point of time, it's selling around 0.008 or a bit higher. It'd be an opportunistic event for someone to try and grab control of the board to as a shell to inject their business. So is that the attempt of all of this meeting that on that?
In general, I wouldn't argue with your premise. I can't speak to the motives of the requisitioners. Scooch and Mr. Peters in their requisition have provided their own statements.
That's what it sounds like to me. Someone wants to take an opportunistic stab at grabbing a board that's got a cash box.
Yes. I will take that as comment, but understood. I'm going to turn now in the interest of time to resolution number 3. Removal of directors appointed prior to closure of the general meeting. The resolution is to consider and if thought fit to pass the following resolution as an ordinary resolution that any director appointed by the board of the company pursuant to clause 55.1 of the company's constitution between 1st of January 2025 and the earlier of A, the date on which the requisitioning shareholders withdraw their intention to move this resolution, or B, the conclusion of the general meeting of the company at which this resolution is passed, be removed in accordance with section 203D of the Corporation Act 2001 Commonwealth, with effect from the close of the general meeting of the company at which this resolution is passed. For the avoidance of doubt, this resolution does not relate to the removal of directors who may be appointed pursuant to a resolution of members. For clarity, I note that no such directors have been appointed. In a sense, this resolution is moot. Nevertheless, the proxies received at 9 a.m. on Sunday, 2nd of March 2025 are shown on the screen. Are there any questions in relation to this resolution?
So there's no actual human beings behind this?
Correct.
Right. I was wondering that. Okay, thanks.
We'll turn now to resolution number 4. Election of Director Mr. Gregory Peters. To consider and if thought fit to pass the following resolution as an ordinary resolution. Mr. Gregory Peters, having consented to act, be appointed as a director of the company with effect from the end of the general meeting of the company of which this resolution is passed. Proxies received as at 9 a.m. on Sunday, 2nd of March are as shown on screen. Are there any questions in relation to this resolution?
I've read the myriad of information that's come from both sides, and I've left 7 or 8 unread, I think, so I've got the gist of what they were probably saying. I did concentrate on the parts that were in bold. People would probably be happy to know. There was the general suggestion that the folks that are part of resolution 4 and 5 would be not qualified or able to take up these roles successfully that they're doing. But the question that just keeps screaming out to me when I was reading everything was just how much worse could it get? You know, my neighbours' teenage kids could probably make a go of it from here, right? Their rudimentary understanding of science and business is probably, again, could it get worse? So again, now I'm sorry. Yeah. So anyway, I was just with that in mind of these folks. I was asking how, and another thing I actually wanted to ask. I'm not sure if I've got access to Mr. Gregory Peters. I don't know, but what I wanted to ask him in particular, and sorry, resolution 5. The name's lost the name. So yeah, I wanted to ask as well. All the announcements and things over time have given me a great deal of confidence and with it, and I got thinking in terms of it being a fixed term deposit. I mean, this is not the best comparison in the world, I guess. But I got to thinking that at some time in the future it will pay off and it will come good. But I think I've now gotten to the stage where I have to think about it as a lottery ticket. It's a thing that may come off in some unspecified time in the future, but I shouldn't place any great the faith in it that I sort of have. So anyway, with these two folks, that's what I wanted to ask. How do they feel about the criticism that they've received that they're not quite up to it? And secondly, how would they think that I should be thinking of it in the future in terms of the?
I want to address. We will come to that. I will.
Right.
I'm prepared to offer at their election either Mr. Cucci or Mr. Peters the opportunity to briefly respond to your points. So it's directed to them. However, I think it's very, very important for all shareholders to just maybe correct one misapprehension you mentioned there. First, you mentioned that investment in a biotech company is more like a lottery ticket than a term deposit. Yes, it is.
Yeah.
This is a very, very high risk investment. I don't mean Percheron is a high risk investment. Any investment in any biotech company, any life sciences company is extremely high risk. Across the entire pharmaceutical industry, of all drugs entering clinical development, 8% become marketed products. So the remainder are terminated somewhere along their course of development, usually with absolutely no return to those that invested in them. So I'm afraid wouldn't necessarily embrace the exact metaphor you use, but this is a high risk investment. I think no shareholder in any biotech company should be under any delusions about that. You said how much worse can it get, and that a high school student could run the business. I'm afraid nothing could be further from the truth. It can get worse in that this company can disappear from the face of the earth. About 10% of microcap biotech companies in the last year are no longer around. The majority of those have not been acquired or have not been merged. They have gone out of business. And it is the absolute determination of this board that is not the fate of Percheron. We are working night and day to make sure that is not what happens. What working night and day looks like is a very, very careful scientific, technical, and commercial evaluation of the many, many paths open to the company at this point. And to give you some sense of the magnitude of that, the board have evaluated over the past 2 months or so approximately 80 individual assets from approximately 50 companies. We've gone through a detailed technical analysis of this very, very wide range of prospects. That requires every little bit of technical expertise in the board and the management team. I can promise you it's not a job for amateurs. And as part of that, we've had to also consider what this means for Percheron as a company, as a business. It's not just a scientific question. This is a commercial question, because at the end of the day, this company has to be investable. It has to attract investors back to the business. And, so that this has to result in a more valuable company. And I would put it to you that these are challenging, technical, time-consuming tasks, and the caliber of the people doing them means everything to shareholders' value at this stage. Now, you did ask a specific question of, I suppose, really Mr. Peters, given this is his resolution. Perhaps if Mr. Peters is on the line, we'll offer him the opportunity to briefly address the question as to his credentials. Okay, all right. What I might do in that case is we'll turn to the final resolution, which concerns Mr. Cucci, and then if he would like, we'll offer you a brief opportunity to address the question in that context, if that's okay. So we turn, in that case, to resolution number 5, election of director Mr. Gennady Kuchin, and to consider, and if thought fit, to pass the following resolution as an ordinary resolution that Mr. Gennady Kuchin, having consented to act, be appointed as director of the company with effect from the end of the general meeting of the company at which this resolution is passed. Proxies received at 9 a.m. on Sunday, the 2nd of March, are as shown on the screen. Now, we do have I suppose, a question on this resolution. So, Gennady, if you'd like to address it, I should say the whole room is mic'd, so you can speak and it will be picked up.
Sure, I guess to address the question is Greg and I and other shareholders who are requisition this meeting do not agree with the direction that the current board is taking the company. And we've selected on their behalf to present this, I guess, choice to shareholders to be able to vote on which direction they feel more appropriate for the company to take on. In terms of, criticism of our backgrounds and our skills, we don't afford to be medically trained scientists, but at the same time, scientists may not run small cap biotech companies that require, other business finance skills, marketing skills, as well as some of the people who know markets, are investors, and can get other very well qualified professionals to manage biotech business, but they don't necessarily need to be the same ones as we've got currently.
Thank you, Gennady. That concludes our discussion on all items of business today. In a couple of minutes, I will close the voting system. Please ensure that you have cast your vote on all resolutions. And just a reminder, as I stated earlier, shareholders who have already voted online by submitting a valid proxy will need to vote again if you have joined online today. While you finalise your votes, I'll be pleased to address any final questions from attendees. Deborah, I don't know if we've had any more online.
We have one question.
Oh.
Can you advise if the company you've made an offer to is an Australian company? Should we go?
Sorry, say again.
Can you advise if the company you've made an offer to is an Australian company?
Can we advise if the company we've made an offer to is an Australian company? I think we'd probably prefer to leave that to what we've said in our public statements at the moment. We have said it is a multinational company. I think that's probably the thing that's most relevant for shareholders at the moment. I think we've perhaps maybe just remain silent on its domicile at the moment, because it's probably not something that has a big impact on value. Ladies and gentlemen, voting is now closed online via the Lumi platform, and in a moment, a boardroom representative will collect all voting cards in the room. I'm going to ask Deborah just to ask the returning officers to join us. Once again, please do ensure that your voting cards are signed. The result of today's meeting will be released to the Australian Securities Exchange via an announcement later today. Ladies and gentlemen, thank you for your attendance at this general meeting. I now declare this meeting closed.